Okay, great. Thank you all for being here. We are here today because Donald Trump is trying to take basic health care away from tens of thousands of San Diegans. More than 32,000 people in this county rely on Planned Parenthood for preventative care, cancer screenings, breast exams, birth control. For many, it's the only care they can get. And when you knock out a major safety net provider like Planned Parenthood, the impact ripples across the entire system. Nearly 900,000 Medi-Cal patients in this county will feel those consequences. Longer wait times, fewer options, and more barriers to basic care. Medi-Cal is the only and most affordable healthcare and reproductive healthcare that hundreds of thousands of people can access here in San Diego County. And I will not allow Republicans in Washington to rip away our reproductive rights and our healthcare rights without a fight. Trump's budget law blocks Medicaid reimbursements to nonprofit clinics because they also provide abortion services. But let's be clear, federal dollars do not pay for abortions. They never have. So this is not about healthcare policy. This is fundamentally about Trump's political retaliation against the people of California, and it is putting patients at risk. So as an attorney and as chair of the San Diego County Board of Supervisors, it is my job to defend people's rights and step in when federal decisions threaten our health. So that's why today I'm asking the board to authorize County Council to support the lawsuits filed by Planned Parenthood and Attorney General Rob Bonta. These lawsuits are the most direct path to stop the Trump attack and protect our health care right now. If this continues, we'll see so many patients suffering, delayed cancer diagnoses, clinic closures, crowded ERs, higher costs, and longer wait times for the entire healthcare system. We cannot allow this to happen in San Diego County. So I'd now like to introduce Tracy Scadden, the General Counsel at Planned Parenthood of the Pacific Southwest. Tracy?
Good morning. I am proud to be the General Counsel for Planned Parenthood of the Pacific Southwest, and I'm honored to be here alongside so many people who are committed to protecting the health care of San Diegans. I want to especially thank Chair Tara Lawson-Remer for leading the efforts today to introduce the board letter to protect Planned Parenthood and access to reproductive health care in San Diego. We are here today because reproductive rights is in a dire state in our country. Over the last several months, the Trump administration has escalated attacks on reproductive health care nationwide, including defunding Planned Parenthood by eliminating us from the Medicaid program. Since September, Planned Parenthood healthcare centers have been blocked from receiving reimbursements for services delivered to patients who rely on Medicaid, which is Medi-Cal in California. Despite this, we are continuing to see patients on Medi-Cal, even though we cannot get reimbursed. We do this because Planned Parenthood is committed to providing care no matter what. The intention behind the defund attack is to inflict as much harm and devastation as possible, even in states like California, where reproductive rights are so protected. The lawsuit brought by Attorney General Rob Bonta and other attorney generals across the country is an effort to stop that harm. And I want to make it clear, as the chair just did, federal funds are not used for abortion care. The current efforts to defund Planned Parenthood are impacting the ability to be reimbursed for STI testing, contraception, cancer screenings, essential services that San Diegans rely on. We know that defunding Planned Parenthood is not just unpopular, it's catastrophic. It threatens access to high-quality care, worsens the country's already broken healthcare system, and places a greater strain on Planned Parenthood and their patients. Unfortunately, nothing about attacks about reproductive rights is new to us. And we will fight, as we have always done, for as long as it takes, for the people who depend on us. We are grateful to have champions at the state and local level helping ensure our communities are taken care of. I applaud Chair Tara Lawson-Remer for leading the way and champion our hero, Attorney General Bonta's lawsuit against the Department of Health and Human Services. If successful, this lawsuit would restore Planned Parenthood funding and access to sexual reproductive health care. The funding lost, by the way, just to be clear, is about 80% of our funding has been lost of Planned Parenthoods across the country, including here in San Diego County. We're so grateful for this tremendous support, and we urge the other members of the Board of Supervisors to support these efforts to submit an amicus brief in favor of the lawsuit. We are proud and grateful to work alongside elected officials who work to protect us and our patients, and today's press conference is a critical step in safeguarding reproductive rights. Thank you for standing with us. I would now like to introduce my colleague, Janine Burlinson, who is Planned Parenthood of the Pacific Southwest, Chief Clinical Operations Officer. Janine.
Good morning. My name is Janine Burleson, and I'm Planned Parenthood of the Pacific Southwest Chief Clinical Operations Officer. Thank you to Chair Tara Lawson-Remer for inviting us here today and for helping us stand for Planned Parenthood's patients across San Diego. As a longtime reproductive health care advocate, a nurse practitioner, and a public health professional, I've seen the profound impact that access to reproductive health services has on the lives of people everywhere. Planned Parenthood of the Pacific Southwest proudly provides essential reproductive health services, education, and advocacy across 3 vast Southern California counties: Riverside, Imperial, and here in San Diego County. Last year alone, nearly 32,000 patients relied on Medi-Cal to access their care at Planned Parenthood of the Pacific Southwest at our 11 health centers in San Diego County. That translates to 23,500 patients who sought and were able to get contraception, 13,500 who were able to get cancer screenings and preventative treatment, and 4,500 people were able to get gender-affirming hormone therapy and care that they needed. These numbers tell the stories of our communities. They speak to the sheer volume of people who come through our doors across San Diego County and beyond, looking for comprehensive healthcare services and education, including contraception, abortion, testing and treatment for sexually transmitted infections, and cancer screening. At Planned Parenthood of the Pacific Southwest, we will continue connecting people to the sexual and reproductive health care services and resources that they need and deserve. We will continue expanding access to reproductive health care and investing in patient navigation efforts to help overcome logistical barriers. We will continue fighting to ensure that our reproductive rights remain protected. But we need your help and the help of our state and local government officials. As a medical professional, I strongly and unequivocally believe that patients who need access to sexual and reproductive health care should be able to do so without facing barriers to the critical care they deserve. At Planned Parenthood of the Pacific Southwest, we are proud to offer high-quality, compassionate, and non-judgmental health care and information based on science and facts. Our vision is simple: to help build a world where sexual and reproductive health rights are basic human rights, and where every person has the opportunity to choose their own path to a healthy and meaningful life. I am so proud to be here with you today to fight this fight alongside you and to continue to push for reproductive and healthcare access for all. I'd now like to welcome a Planned Parenthood patient, Victoria Lara.
Thank you and good morning. I'm so glad to be here today to share my story and how Planned Parenthood is so close to my heart. My name is Victoria Lara. My pronouns are she, her, ella, and I'm a Planned Parenthood patient, former president of Planned Parenthood Generation Action, and a law student here in San Diego. Now more than ever, access to sexual and reproductive health care is essential. As it is, there is already a lack of access to care in many parts of our state. Defunding Planned Parenthood would only make access worse for so many communities, some of them mine, including immigrants, people of color, LGBTQ+ communities, and people with low incomes. Planned Parenthood of the Pacific Southwest sees over 112,000 patients each year, myself included, who most of which rely on Medi-Cal to access that care. Medi-Cal is also the largest payer of family planning services that Planned Parenthood offers. Reproductive health care like birth control, wellness exams, STD testing and treatments, cancer screenings, and so much more. I myself have counted on Planned Parenthood for compassionate and affordable sexual and reproductive health care. If I didn't have Planned Parenthood, it would have devastating consequences for myself and for hundreds of thousands of other patients across San Diego County. At a time when our freedoms and autonomy are at risk, we need the support of our local and state governments to ensure that we can get the health care that we need and that we deserve. We should all be able to access reproductive health care in welcoming environments with providers of our choice that we can trust and that have no barriers and no interference. I remain grateful to the compassionate Planned Parenthood Healthcare Center staff for taking such great care of me. From the moment I walked in, from start to finish, I knew that I was in good hands. And that level of care would have never been possible without Medi-Cal and without Planned Parenthood. Action is a cure for despair, which is why I'm here today to ask everyone to help us support and do everything in our power to help defend our well-being and protect everyone who be disproportionately affected by these cuts. Our health is on the line, and we hope that we can count on your support. Thank you for your time, and I'll now pass it over to Miriam Guerra.
Good morning. My name is Miriam Guerra, and my pronouns are she, her, ella. I'm a former Planned Parenthood Generation Action member, a Planned Parenthood advocate, as well as a Medi-Cal recipient. As many of you know, Medi-Cal is a public health insurance program primarily funded by the federal government. More than 72 million people in the United States, including myself, peers, and my neighbors, use Medicaid to access their health care. I'm a reflection of my community here in San Diego, and I've seen firsthand the huge impact that it can have on somebody's quality of life. It covers essential and necessary services such as doctor's visits, hospital stays, prescription drugs, as well as long-term care. It was because of Medi-Cal that I was able to receive the care I needed as a child and young adult. It provided me with continuous and life-changing care that allowed me to focus on my family and future. Since the age of 16, I've been plagued with various general and reproductive health issues, and just last year, I was diagnosed with polycystic ovarian syndrome. Thanks to Medi-Cal, I was able to not just receive my diagnosis, but I was able to speak to professionals about decreasing my risks for cervical cancer. To simply state, without Medi-Cal, I wouldn't be where I am today, a proud first-generation college graduate, as well as an aspiring physician. I proudly join my voice to this movement, since it affirms that all people deserve to make their own decisions about their health, life, and future. I'm grateful to the Board of Supervisors for continuing to fight for San Diegans, for us, for our right to accessible health care. I believe that everyone deserves to live happy and healthy lives surrounded by those they love, and programs such as Medi-Cal help that happen. Thank you.
Okay, thank you all very much, and we're happy to take any questions. If there's any questions, or we can just go to one-on-ones. Okay, great, thank you.